Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists veterinary associates with employment contract and independent contractor agreement issues. Today I'm going to talk about veterinary contract red flags. So, things you need to think about and be very certain that the language in your contract is not going to come back to bite you if and when the contract is terminated. So first, talk about some compensation traps. It's very common in the veterinary industry to have some kind of ProSal-ish method. I mean, people can, structure the compensation in 100 different ways, but it is decently common to have some kind of collections-based contract, meaning the vet would receive a percentage of whatever they personally, whatever the practice collected based upon their personally performed services. And so negative accrual is something that's fairly common as well. Let me give you an example. So normally they would come up with a base draw, and let's just use 120,000 per year as an example. So you get 10,000 per month. And then a normal way of doing it would be they would compare what you brought into the practice versus what they paid out to you. And if there is a negative balance, then that would move forward to the next month. Then you would have to obviously make more in the next month to take care of the previous balance. After a year in practice, this generally is not that big of a deal. But what you can't do is have some kind of negative accrual from the very beginning. You should always have some kind of guarantee period. I would suggest at least a year where you just get like a flat base salary or something among those lines where there's no kind of collections-based percentage. The only kind of percentage you should accept in year one, at least, would be some kind of bonus productivity, meaning maybe at the end of the quarter, they would do kind of the same calculation. They would take what they paid you versus what they collected, and then you would get, I don't know, somewhere between 15 to 20% of whatever was left over. But in the scenario where the math didn't work out and you didn't bring as much in, there would be no negative accrual. And then perhaps after year one, you can transition into more of a collections-based contract, and the odds of you having some kind of negative balance moving forward are much lower. All right, so that's the first thing, compensation traps. Next would be some kind of broad non-compete that could stop you from practicing after you're done. There's three parts to any non-compete. You have the scope, meaning what you can't do, the temporal restriction, how long it lasts, and then the geographic restriction, in what area can't you work. And so in veterinary medicine, there's different roles. You could do relief work, you could do urgent care, you could do emergency, you could just be in like a small animal general practice clinic. And so you want to make certain that the scope is specific to the things that you're doing for that employer. So if you're working in an emergency hospital, then you want the non-compete to say you can't work in an emergency hospital for 1 year and 10 miles of the, where the hospital is located. You don't want it to say you can't practice veterinary medicine. I mean, it's a bad argument on behalf of the employer if they're, only run an emergency hospital and they're saying you can't work in like a small vet-owned small animal clinic or an equine practice or something like that. So make sure the scope of it is specific to what you're doing. This just gives you flexibility when the contract ends. You don't want to have to move or anything like that to get through the restrictive period. Next would be termination. So things you need to think about when the contract terminates. Do you have to pay back any bonuses? Because that's fairly common if you leave within the initial term of the agreement. Do you have to pay any malpractice? If it's a claims-made policy, do you have to pay tail? It's pretty uncommon in the veterinary industry to have a claims-made policy. Most of the time, it's going to be an occurrence-based policy, and most of the time through the AVMA PLIT. But in the scenario where you do have claims made, who has to pay for tail, and then how much notice do you have to provide? You do not want a very long notice period. If you see a 180-day notice period, that is a huge red flag for two reasons. One, well, first, 60 to 90 days would be an industry standard amount of notice. If it is like 180 days, It usually means two things. One, perhaps they're having a very difficult time keeping people, and so they want to make sure that they lock you in for a longer period of time. And then two, when you're trying to find a new job, some places don't want to wait 6 months until you're available after you give a notice. So you want to make sure that is, relatively short. Well, those are just a brief, kind of discussion of red flags in veterinary contracts. There's probably a dozen more things that we could discuss. But for brevity's sake, I'm just going to stick to those points for this video. If you have any questions about an employment contract, independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.